Hello and welcome to Wake Up America. Today's topic, paying for health reform. There is an astutely organized and intricately well-funded organization in the United States which has currently set itself against any and all ideas of healthcare reform. Much of the healthcare industry is in favor of reforming the decrepit system in which they operate. Many healthcare professionals are in favor of reforming the system which they see every day to be inadequate and unfair. Unfortunately, the health insurance companies are against all of these changes being proposed by the House, the Senate, and the White House. They control the purse strings, and after decades of raising premiums, cutting benefits, and entrenching their costs on the shoulders of their customers, they have plenty of money to pay for it. Josh Bivens of the Economic Policy Institute, in an article entitled Reform We Can Afford, gives a complete overview of the bills and the real costs associated with them. The insurance companies and their affiliated groups, as well as the congressmen they fund handsomely, are talking about the excessive costs of health reform. In particular, they have focused their attention on an alleged $239 billion price tag. This was even the focus of a major misinformation ad campaign run during news broadcasts by the Chamber of Commerce. The proposed $239 billion is made to seem like a lump sum cost. In actuality, the Congressional Budget Office projects that the House version of the health reform bill will add $239 billion to the deficit over the course of 10 full years. This is hardly a drop in the proverbial bucket in terms of government spending overall. Furthermore, according to Bivens' assessment, the only reason this cost is even part of the bill is because lawmakers were attempting to remove a Bush-era budget gimmick which rescinds Medicare reimbursements to physicians. Under the old law, the government kept more money than it should have, to the tune of over $20 billion annually. This money should have been outlaid to Medicare participants. The reform bill gives this money back, in essence giving every American more of what they already pay for. This is just one of the many problems with the campaign to end healthcare reform. The bought and paid for Republicans and Democrats in Congress are trumpeting the cost problem because they do not want a public option which will cover millions of uninsured Americans. What they ignore is the fact, backed up by the EPI, the CBO, and other nonpartisan groups, that healthcare costs will rise in the future if we go on without significant reform. The whole reason we need a government competitor to the private insurance companies is because private insurance takes too much for itself and continually increases the cost of care for its own benefit. If we ignore healthcare reform now because it costs us hundreds of billions of dollars to remake the system, we will end up costing ourselves trillions more in the future. For a country already swimming in debt, that is a fate we simply cannot allow. On behalf of concerned citizens, I'm Craig Harrington. For more on this and other related news, tune in and log on every day at economyincrisis.org.
Wake up, America. Open up your eyes. Wake up, America. Wake up.